Hi guys, I'm Dr. Schwartz. This is Psych Talk. Welcome back to my channel. So what is social anxiety? Today we're going to talk about some signs of social anxiety and how we recognize it. It is not shyness, not the same thing. Although there are a lot of similarities, it is not schizoid personality. Although there are overlapping signs and symptoms. It is a real, legitimate psychiatric issue. People with social anxiety might have a fear of being judged, so they avoid situations like job interviews. They might worry excessively about embarrassing themselves or interacting with strangers. Sometimes the thought of being noticed is scary, and it feels better to be invisible. A lot of times people worry about blushing or sweating, any of the physical symptoms that might cause embarrassment. That can include trembling or shortness of breath. Oftentimes people will avoid doing things that they're interested in doing and avoid doing anything that involves getting attention or being the center of attention, and that includes things they really want to do. What happens is there's a tremendous amount of anxiety in anticipation of an event, and intense anxiety when forced to be involved in social situations. People with social anxiety will excessively self-criticize, often going over and over whatever interaction they've just had, feeling terrible about it and questioning everything they said and everything they did. This can be extremely difficult for kids in high school, who of course have continuous social interactions to endure, and often wind up expecting the worst at all times. Of course, all of this leads to lots of consequences. Reluctance to use public restrooms, reluctance to return items to a store, or enter a room that's already filled up with people, difficulty in social situations, fear of dating and intimacy, problems with relationships, feelings of extreme stress, even in a really supportive workplace, just because of the social interactions. Some people even find that they are unable to attend school or attend work. Some people with social anxiety experience other physical symptoms such as chest pain or shortness of breath. Some experience panic attacks or depression, headaches, dizziness, gastrointestinal difficulties, chronic stomach aches, and lots of other physical complaints and problems. So as you can see, social anxiety is very serious. It can be extremely painful to live with. However, and this is the really terrific news, it is one of those things we can treat. We'll go into treatment of social anxiety in more detail in another video. But for now, I will end it here and say that there is tremendous hope for anybody who is struggling. The time to get professional help is if you feel you meet any of these criteria that I've noted, if you have any of these signs and symptoms, and if you feel your life is being affected negatively. That's really the key. If you feel that you are unable to do the things you want to do in your life because of any of these signs or symptoms that I've listed, that's the time to get help, because we can really, really make this better. So see a professional, get some help, get better, and live your life. Thanks. I'm Dr. Schwartz. This is Psych Talk, and I'll see you next time.